In this series, we speak to inspirational people who are working in global health. They share their journeys about where in the world they have worked, the issues they are passionate about, and how they got involved. Whether they are students, young professionals, or established in their careers, they all have one thing in common: to change this world for the better. Coming up in this episode, we speak to Dr. Ciara Conlan, who shares her experiences with us as a med student in Ireland, her work in rural Malawi, and her role in founding the Access to Medicines Ireland campaign.
I would reach out, to organizations like the Global Health Network or COLOV, and, maybe just to try and find a community that you can be part of. And I think in global health, you definitely have to be ready to just celebrate the small wins and victories. And it is hard, and you're just one person. But I think if you're interested in global health, there's always a way in, and just to reach out and try and find your own community.
So welcome everybody. Today I am speaking with the wonderful Dr. Ciara Conlan. She's a medical doctor. She's studied in NUIG. She specializes in infectious diseases, and she's also a co-founder and a campaigner with Access to Medicines Ireland. Ciara, you are so welcome.
Thanks, Nadine. It's so great to be here, and always lovely to talk to you.
Same. And we're so interested just to learn more about you and just to share, just for you to share with others, some of your experiences. So I would just say to you, how did you, even medicine, how did you choose medicine, even starting off in your career? And you're still very early in your career.
I think I was kind of born like a medicine and global health person. I think a lot of kids actually have like a really strong sense of like fairness, and I definitely had that, which was encouraged by my parents and some teachers that I had. And I loved people and animals. I chose to go down the medical route and was lucky enough to get accepted to medical school in NUI Galway. I haven't really looked back since.
What was it like studying medicine? There'll be people listening here who will be thinking about medicine. I mean, what was that like? Was it as hard as they say it is studying medicine? Was it full on?
Yeah, I mean, it was definitely tough. I suppose when I look back, my first couple of years in Galway was like a really busy time. I probably got sucked in a bit into like this cycle. I was studying really hard, but it was also like partying and going out a lot. And then, at some point, kind of, I realized I wanted to get a bit more out of college as well. So, and I was lucky enough, I got to go on away in Erasmus. So got a bit of time away from all that. I went to Switzerland, and it was really good for me. And I actually ended up meeting all these wonderful students who are really involved in activism for access to medicines, who really inspired me. And as soon as I met those people, I was like, okay, boom, this is my tribe now. And I have to go home to Ireland and kind of try and get this going here and start it up. So that's what I did when I got back to Galway. Started my own little campaign group for equal access to medicines.
So when you came home from Switzerland, right, you were finishing as a med student, and then you went to work in James's. So tell us a little bit about what it was like working in James's, and what kind of work were you actually doing? What was your speciality at that point?
Sure, yeah. So when I went to James's, I was an intern, and you work across 4 different specialties: medicine and surgery. And it's very busy. Basically, you were taking notes and doing all the jobs that has to be done for each patient. You're not generally making big decisions, but you're kind of like the workhorse of the team, I suppose. But I loved it. I loved the experience. I love the transition to work. And it definitely, I suppose, a lot of my interest in access to medicines was very kind of academic. Until then, I hadn't really felt or experienced kind of the real impact on patients.
So I'm just wondering, there you were, in Dublin, and then you're working with patients, supporting patients, and then those issues around access to medicines, how did they become real in the day-to-day jobs that you were doing at that point?
Yeah, I think it definitely gave me a more nuanced view of what access was. And when I was a student, I'd focused a lot on access to medicines. For example, even the lack of research being done into neglected tropical diseases, and the lack of kind of translation of medical research at universities into actual medicines for patients. When I started working as a doctor, I saw like there's access issues throughout all of healthcare, whether it's patients, trying to get access to mental health services, or physiotherapy or whatever it is that they need. And these really high price medicines have a knock-on impact throughout the whole system. And that's what I started to realize more and more as I was working.
So how did you then, you're in James's, these issues, it's like access to medicines was a theme that started in university for you and then continued on. And then you made a decision to actually spend some time working in Malawi. So tell us a little bit about that, because at that point it must have moved, you really must have shifted into kind of global health. There was health here in Ireland and then there was global health. So tell us a little bit, what were you doing in Malawi?
Yeah, so I had always wanted to go to Africa since I was a really small child, and it had been a dream that was there. I suppose I didn't want to go, like, I kind of felt maybe after 3 years of medical experience, I might be in a position to be a bit more useful while I was there. So I went to work in a small kind of rural clinic, very much like GP work. A lot of it was, providing contraception, treating STIs, but also dealing with things like malaria, being first responder at road traffic accidents, things like that. So yeah, it was very, very busy, very different world. Definitely appreciated whatever problems we had in Ireland were, in terms of access, were so much worse in Malawi for so many reasons. So again, it just kind of helped me develop my understanding of health systems and how they can work in different places.
Do you think there's some things that you learned in your time in Malawi that you then brought back home with you and really kind of use and tap into day to day back in Ireland?
Yeah, I think so. I get asked what I learned from Malawi quite a lot. And actually, I don't think the chapter is closed. Like, I think about it every single day and I'm still reflecting and learning from it. And I wouldn't want to, I suppose, tell anyone what they should learn from my experience either. I think, like, honestly, I think my heart just grew while I was there. I met so many wonderful, amazing, and resilient people who I'm still in touch with. I think in Ireland we can be quite shielded from some of the harshness and I suppose the harsh reality of life. And we can also be like shielded from lots of other things, like, where our food comes from, like our relationship with nature and climate, which are very real in Malawi. And, maybe I didn't have to go there to learn that, but it's definitely something I've kind of kept with me, I suppose, and will try to always remember in future. Like, I think it's helped me in lots of ways, and I don't have any ego about it. I know I was only there for 6 months and I just helped the people that I could while I was there. And I think, I hope they know kind of that I really do love them and I'll be there for them and help them, in whatever way I can in the future, so that chapter isn't closed.
I'm sure it's absolutely not. I know it's not closed for you. And I suppose, like me, I spent a lot of my my life working overseas in Africa and Asia. And there's always people and experiences that, you're touched by many. And then there's the few that just really, really touch you so deeply in your heart that it's really imprinted and you carry that with you. Is there one or two people that you could say, yes, they were the people that, I don't know, you were really affected by in Malawi? And if so, I mean, what was the story behind that?
I have to say, definitely, like, there's one gorgeous family in this village called Kudzi Bay in Malawi, where I used to visit a lot. And yeah, I became really close with this family. And I don't think they'd mind me telling their story because, they're such good friends of mine now. But basically they have two small children, who I kind of call like my children or my godchildren. But their mother is actually suffering now. She's got advanced cervical cancer, stage 4, which has gone beyond treatability, I suppose, which is really, really hard because it's just such a preventable cancer. It's so preventable. In Ireland, we have the rollout of HPV vaccines for girls and now boys, which is just absolutely fantastic. We have a really good cervical cancer screening program, which I take part in myself, and I encourage everyone to do so. Yeah, so just when you see something like that, it's so hard, and you can't, I don't think it's something you can really get over, and I've just tried to help them as much as I can. But I guess if she lived in a different country and anywhere else, it could have been picked up earlier and prevented. So yeah, it inspired me to do a lot of research into HPV vaccines in Africa and the delayed rollout there, where they would actually make the most impact. So yeah, definitely also adds more meaning to the work we're trying to do at Access to Medicines Ireland as well.
Yeah, and I love that she's with us. That your friend is with us as we talk today as well. And for all of us, just that reminder about cervical cancer as we talk about these issues and make them real, to make sure that you go for your smear test. And I also am very proud to take part in that program, in our program here. So when you're talking about, Access to Medicines, it was incredible. You were so young when you co-founded Access to Medicines. Your vision was so great, and it must feel very good for you watching. So many other people are on board and have come on board with the Access to Medicines campaign. What's it like watching Access to Medicines grow the way it has grown?
Yeah, I feel so proud and happy to be part of this movement, and it's not something that's just happening in Ireland. It's definitely, it's all over the world. It's been really brought to the fore by COVID-19. I suppose, unfortunately, in some ways now we're seeing like this impact in real time of lack of access to vaccines and other stuff, due to monopolies which are blocking production. But yeah, so back to the positive stuff, I suppose. I am really proud of how the organization has grown in Ireland, and it's taken a life of its own. If I ever need to step back for a few months, I can. There's enough people there. It's a really diverse group of people. There's only 2 of us that are doctors, which I love, so there's people there with backgrounds in law, science, business, grassroots activism, nursing, so it's not, you don't have to be a doctor to make a difference in whatever you're trying to do. So yeah, I'm really happy, and I think it's really topical and really important.
Would you say, the issues around the vaccines and inequity in relation to COVID specifically, what are the main, for people who are listening who, really care about this, but don't really understand the issues? Like, if you had to summarize it for us, what are the main issues? Why is it that not everybody can have access to the vaccine?
There's just not enough vaccines in the system, essentially. I just firmly believe that everyone who can be making vaccines should be making them right now. And that is not happening. There's a few reasons, but can't deny that intellectual property and patent rights are a major barrier to facilitating vaccine production. So that's something we've been working on a lot at Access to Medicines Ireland. Basically we need as many people as possible, as many companies as possible to be making vaccines. And the shortage hasn't been helped by, richer countries buying up huge numbers of vaccines in pre-purchase agreements, more than they need per head of population. Something that everyone said they weren't going to do, that vaccines and other medicines and treatments were going to be global public goods. It just, in real life, it hasn't turned out as we had hoped.
No, and it's not even, these issues are not new. I remember for instance, with the HIV/AIDS epidemic, we had these issues were the same with access to ARVs, to antiretrovirals. And why are we not learning? Why are we here, say 20 years later than the activism around HIV, having the same kind of conversations now around COVID? Why is that?
Yeah, I think until there's systemic change, unfortunately, it means we'll be fighting the same battle every time a new medication comes onto the market. So I think there needs to be more recognition of the fact that a lot of the basic research is done at universities, it's publicly funded. There should be conditions attached to this research. We need to recognize that one size doesn't fit all for intellectual property rights. Patents are not fit for a pandemic. And yeah, even before the pandemic, waiting 20 years for access to a medicine until the patent expires is not good enough for most patients.
No, and I mean, what are other examples of medicines have you seen that where these issues around access, where medicines are just not getting to people for the diseases and the illnesses that they have?
Yeah, I suppose in some ways we're lucky in Ireland that we do eventually get access to a lot of these drugs, but patients still do experience significant delays oftentimes. Like the patients with cystic fibrosis who had to fight for a long time to access Orkambi, for other cancer patients who had to wait a long time for pembrolizumab and other drugs. So we're not immune to having these issues in Ireland, for sure. And then I suppose, as I was talking about, there's, we've rolled out HPV vaccination for girls in Ireland, I think years and years ago, and it's going to be years and years into the future until that same service is offered for people living in poorer countries.
Ciara, what would you say? I mean, I think it's incredible, working as a doctor, that you're also so involved in activism. What would you say for, med students? What is it that we need to do for medical students to help them become aware of the global nature of health?
I actually think I have great faith in the medical students. I think a lot of them are really good and aware of these issues already. And it may be more like, that there may be a little bit of a feeling of helplessness, or like there's so many issues nowadays. It's so hard. Their education's been disrupted already by the pandemic. But I think like if you're interested in global health and if you're thinking about it, that's already like a really good start. I suppose I would reach out, to organizations like the Global Health Network or COLOV, and, maybe just to try and find a community that you can be part of. And I think in global health, you definitely have to be ready to just celebrate like the small wins and victories. And it is hard, and you're just one person. But yeah, I think if you're interested in global health, there's always a way in, and just to reach out and try and find your own community.
And then just a last question. I mean, do you have plans? I know you're back working at the moment in UCD, and I mean you're working in the National Virology Reference Lab. What are your plans for the future? Where do you see yourself going? Do you have a plan, or do you allow yourself to kind of be moved by what comes in front of you?
I suppose I'm open to opportunities, you might say. I mean, I want to keep working at what I'm working at and volunteering with Access to Medicines Ireland. I also want to be happy and prioritize balance in life and relationships and other things I enjoy. I suppose in the future, yeah, I'd like to get, a further like qualification, like a full specialization somewhere in the field of infectious diseases. That would be a big dream for me. Yeah, and also just to continue to develop the campaigning work with Access to Medicines Ireland, because I can't really imagine my life without that now.
Yeah, and I can't imagine Access to Medicines Ireland without you. For people for people listening as well, I mean, I know it's very open. The campaign is very open, and you can, everything is available on the website. Access to Medicines. It's accesstomedicinesIreland.ie. Is that right, Ciara?
Yes. Yeah.
Yeah. So, welcome for people to go on there and find out more information. And as we leave, is there any, if there's young people listening who are maybe even, behind you, coming along, maybe starting their studies, and maybe some of them nearly finishing their studies, is there one piece of advice that you would give a young person at this point? And it could be somebody in, studying anything that is relevant to global health.
Yeah, I would say, there's always a way into global health, and, don't be worrying. Like, when I was younger, I kind of thought you had to study medicine to be into global health, and I ended up doing that. But now, as I've got older, I've realized, that people that add like so much value to it are coming at it from a completely different angle, which I love. It's just about using your own talents and what you're good at. Like, you might write a song which inspires loads of people, whatever it is that you do, and there's always a way to make a difference. Yeah. So come to Medicine Ireland.
Yeah, and thank you for making a difference in the way that you do, and inspiring all of us and showing us what is possible. Something that started in university as an idea and a vision, can just evolve, and you bring other people along with you. And thank you for that.
Thanks, Nadine.
So thanks for joining us today. If you want to know more and get involved in the Irish Global Health Network, then go to our website, sign up, become a member, and see how you can be active. Go to www.globalhealth.ie, and we look forward to the next episode.